Welcome again. You are coming from where? Sweden, right?
Yeah.
Sweden. Normally, you are from Ethiopia,
Yeah, Abyssinia, Eritrea.
Eritrea.
Yeah.
Ethiopia is Eritrea, different countries.
Yeah, I mean they're related, but they're different countries.
Yeah, actually, they are all maybe the same roots, but they are divided. So, is it Habeshistan? What we
Exactly.
call Habeshistan?
Yes.
Najashi is the
Yes, exactly.
famous king of Habeshistan in the Islamic history. Very, very important. Okay, so but you live in Sweden.
All my life.
Oh, you live all your life in Sweden. So how did you discover you have a varicocele?
Well, I had different issues with what you can say
Hormone levels, right?
hormonal issues, and we started investigating, and
You
then I
you have
want
a
to know-
changed mood of life, you said, right? Your mood change, your libido
Yes,
change.
I mean the testosterone. The biggest effect is like you have depression, bad mood, and lack of energy in the body.
Yeah, and you have testosterone. You feel your testosterone levels were decreased. How was your fertility? You have children before, right?
Yeah, I mean the fertility because was very. I mean still very good actually.
Yes.
Because it just on the one side, plus it's only like partial decrease. So
Yes.
it's not, but it's more about life quality, energy, and the mood is very important.
And they in Sweden, the doctors recommended you varicocele operation.
It was actually I discovered it myself by reading.
Yes.
And then I brought it up with a surgeon because I had like gynecomastia
Yes.
treatment surgery, and he confirmed there is a varicocele, and he sent me to the hospital, but nothing happened for a very long time.
Yes. Yes.
So that's why in the end I came to a private doctor
Yes.
here with you.
How did you find me?
I think it was like research while I was researching about
Yes.
varicocele. I found you in YouTube.
Okay, YouTube channels.
I see about different surgery, and I saw your technique
Yes.
because the problem is that in Sweden, the way they do it,
Yeah.
they say it's very likely that it will fail.
They say themselves. They say by themselves.
The very high percentage that
Yes.
it fails because they block the
Yes.
vein somewhere here, up here.
Actually, they are honest. They are honest because thanks them, I respect their way of this kind of treating. They explaining the result very openly. They are honest. It's because usually urologists are not aware that the varicocele operation has a very high recurrence rate. They say, "Oh, I operate microscopically. It is 95% successful." It is not. Even you do microscopically, it has at least 30% recurrence rate. I observed this with my Doppler ultrasonography after the operation. My operations previously, it's very high, 30% recurrence rate. And I discovered the technique is not enough. If you just spare one artery and one lymphatic channel and block every vessel, okay, it is 95% successful. But in this case, you are most probably ligating the sub branches of arteries.
Yes.
There are little sub branches, and in the internet in United States there is Cornell, University of Cornell. They show their technique, and in this technique they spare one artery, one lymphatic, cut everything. I am sorry, but in this operation I am sure they couldn't understand there are some sub branches of arteries, and they mistakenly cut these arteries. If you do like that, microscopic varicocele surgery is 95% successful. And there are reports, laparoscopic varicocele surgery is very successful because I saw the videos. I'm shocked. They take out the spermatic cord in laparoscopically and cut everything, artery, vein. If you cut artery, it is 100%. There will be no recurrence because no blood is going to testis anymore.
Okay.
So it is 100% recurrence rate will be successful. But in a classic normal microscopic varicoceles surgery, recurrence rate is very high. That is why I changed the technique. I find out taking the veins out as long segments. In your operation, before the operation, when we do Doppler, we saw huge veins. And you didn't have Doppler in Sweden, right? You just recognized it by yourself. How did you do it?
I mean, exactly. So, because I felt there is something there. And first I was worried, is it cancer? What is it, you know?
Okay.
So
yes.
I did have first it was confirmed, no, it's not cancer.
Yes.
And then he said it's something, and then I found what it was, and then the surgeon, he also looked, he confirmed that the description.
Physical examination is very important.
Yeah.
Urologist can understand the varicose veins with physical examination, but sometimes not enough. We have subclinic varicocele, which means in physical examination there is nothing in Doppler you can find. But your varicocele was grade 3, so it was visible, it was easily palpated with physical examination, and you had the diagnosis. Did you have any symptom other than testosterone decrease, like sweating of that part, pain in the testicle? Did you have anything?
Pain, sometimes I had pain.
Yes.
But so this is basically the only reason that they allow the surgery in Sweden is that if you have a lot of pain.
Yes, this is very important point. Yes.
But they also say it's is you take a risk.
Yes.
With the arteries and everything.
Yes.
When you do it.
And the success is.
And it's very. It doesn't change the problem anyway. It doesn't solve the problem.
Yes.
So that's why they say it's basically pointless.
It's very important what you say. You say they operate only for pain.
Yeah.
And they say it is maybe only 50% success rate for pain. They cannot resolve the pain for 50% of the patients. And there are many risks like cutting the artery and having hydrocele, such things. So people are afraid of having this procedure. We use microscope to see in more detail. We use microvascular Doppler device, which every vessel I see, I control with Doppler if it is an artery or vein. Normally in microscopic view, we see pulsation, movement of one vessel. It is artery. When we control it by Doppler, we understand it is artery. But there are some little sub-branches of arteries. This is not pulsating. But with Doppler device, I understand this is artery. So it is important. I give higher rates of getting rid of this pain. And testosterone issue, it is important. This is not a total indication, but many people, especially I hear from Holland, Belgium, Denmark, from these countries, people, if they have varicocele, after 40 years of age, everybody go and try to solve this problem and have varicocele surgery just for testosterone increase. Is it common in Sweden too?
It's. I mean, unfortunately, the testosterone treatment is a bit taboo or something like this, and it's also the problem with low testosterone is like lethargy and maybe
gynecomastia maybe also because of it.
Maybe, but so the person who has low testosterone doesn't have a drive to complain because you have to complain a lot to get help. But
you don't have to drive the complaint. They are not complaining because they are so.
You just give up.
Oh, very important, very important.
So I think a lot of people have problems.
So after the procedure, there have been only near 1 week. And how do you feel with your post-operative days?
I feel my mood which is the most important thing. I was improved and physical energy because I used to get tired walking.
Yes.
But now I feel like I want to start training. I have a desire to start exercising and go for walks and Yeah, well, I mean, first I was directly after the surgery, I had a lot of energy, but I was like, maybe it's the drip.
Yes, yes, you have the serum going, and when you ask me, hey doctor, I am feeling better after the, I said, oh, we can't increase the testosterone in 4 days, 5 days. It is psychologic probably, but I know from my patients from Holland especially, there is really a good response, good positive response to varicocele procedure. People have it not for child, not for pain, just for increasing testosterone level. Okay, it is proven in our researches too. Testosterone level increases after varicocele surgery, but usually we don't do it for it. So people come to us, hey, I have pain in the left testicle, please operate. But most of them does this procedure just for increasing testosterone.
Yeah, I think it's the problem is the two separate fields.
Yes.
So you either meet the let's say what's it called, the hormone
endocrinologist,
and
yes.
they will maybe
give you testosterone.
Medicine. But actually, I don't prefer that either, because you have to take a needle every week.
Or there are long-term needles like every 2 months, for example, but it's still an injection is coming from outside.
Yeah, I even feel that the testosterone level goes up and down.
Yes.
So you have, in the beginning of the period is like, oh, now I feel good, and then in the end is like, I just wait for the next shot.
Of course, natural sources are the best. Your body has to produce it. And if your varicocele was extreme, if I see only 2 vessels and you insist, please do this operation, I would say, please do not push me to do it, because there are only 2 tiny vessels. I recommend, if somebody will have this operation for testosterone increase, they have to be sure that they have big bundle of veins, which I see in your testicle before the procedure. Or in Doppler ultrasonography, they have to be many big vessels, more than maybe 3.5 millimeters. Normally, after 3 millimeters, we say it is varicocele. But I want, like you, big veins. When we take out big veins, it will work for a good varicocele response. I cannot guarantee testosterone levels. We don't previously was working on this. There are some research saying it's good for testosterone increase. But still, we are away from it. But as in your case, it may work. I think it will work for you. Do you believe?
Yeah, I mean, for me, it is already worked. Just I hope it heals and everything continues like this.
Yes, yes.
And so I have a lot of excess weight, but now I feel like I have the energy to start exercising and get.
So you wanted a better procedure? I mean, with a low recurrence rate. That's why you come here. Is it true?
Yeah, I mean, it seems to me like your method resolved the issue that the other in Sweden they say the problem is you still have the issue remains basically.
Yes.
So you solved by going in and taking away everything.
Yes.
So
normally, if we do in classic way, when I look today, I would see I ligated, for example, if this is the vein, dilated varicose vein, I would ligate it in classic operation, and this vein today will be there. This will disappear by time, maybe 3 months, maybe 6 months, maybe 1 year, maybe not, and we call it recurrence. But today we remove this, your testicle is free, fresh, calm, cooler, and the good effects begin today. I don't think your mood change is related to testosterone increase, but maybe because it was under pressure. Your testicle was under pressure. So, but your varicocele is over now. So, in every minute, it will be better and better. We don't have to wait for disappearing of this vein, which in classical operation at least 3 months, and maybe never. So, it's a good procedure.
Yeah, so I just want to be careful so I don't exercise too early, maybe break something.
Yes, actually, in my patients in Turkey, I say them, now we've finished half of the procedure. I make controls very frequently, and Try to see. There are always some. When I take this out, I have to stop somewhere, and this is testicle. This comes to testis. I have to stop in testis. So there are some intratesticular or around testis, some little buds, little ends of this vein, like this length, and I control them frequently, and I make the patient strain, push themselves, and I see the reflux there. And after 1 month, maybe all is disappearing, this little residual parts. So till that time, I never let them do excessive exercise. And maybe after 6 months, I make another control, I make them strain. If there is still reflux to little tiny vessels, I say, please don't do excessive exercise. Because this patient is prone to have recurrence. Why? He has only 1 millimeter little vein, but it is still refluxing because the vasculature has corrupted, it's destroyed before. The vessels, they have little tiny structures in it to prevent reflux. So these are destroyed, and this patient may have reflux to little tiny vessels. So I recommend to anyone who has this operation like you, if you will do sports, do swimming. Do not do high gym exercises and increase your intra-abdominal pressure. Do gym exercise, do walking. Simple, long term, don't push too much. And for first 1 month, 3 months, really rest. Don't push. So I have recurrences previously. Still I have recurrences, of course. Very low percentage, but still I have. Mostly they are the ones who have to do this because of their professional jobs. They have to lift heavy weight, such things. So try to keep your exercise as low as possible.
Yeah, okay.
Swim. You can swim. No problem with swimming.
Yeah, I like here in Istanbul walking around. It's
okay.
It's like it's also we're very happy to come to this very beautiful city. And,
Thank you.
And I'm very happy also like the procedure, everything went as planned.
Yes.
So that I'm very happy.
Yeah, we are doing it for maybe 10, 15 years. I have more than 5,000 cases in varicocele. So, and for abroad, we are overseas, for other countries, we are doing 5, 10 years. I am doing varicocele surgery for 20 years actually. So it is doable. We can do it from patients coming from abroad and send them back home safely.
Because I'm I'm very interested in medicine like a hobby.
Yeah.
So I read a lot, and I did a surgery before, so I read about this, and something I noticed that it's very important for the surgeon to have a lot of experience in that surgery.
Yes.
And so, the problem is if you go to the government hospital, they have like a general surgeon who does different. Maybe he never did this, but I know this is not like experimental for you. You have done this so many times, and
really, you are telling what I am telling to patients. Normal urology doctor have to do many things: kidney surgery, prostate surgery, circumcision, bladder surgery. So they usually operate 2 varicoceles in a month. Okay, it is good, but I do maybe 15, 20 cases in a month. So we are always, our hands are warm. We call it in Turkish like this. We always, our hands on work on this. And if you ask a doctor, what do you think about varicocele surgery? They say, oh, it is so simple, 15 minutes, come, I will do. What's the recurrence rate?
So maybe they just cut away everything.
They are
this
right.
This is very precise method,
Yes. So they don't. It is not very important. It's not considered as a very important surgery. But my life is varicocele surgery. I work for it. My hobby is this. So I am investigating this and researching this procedure. Maybe most of the doctors will say, "Oh, there is no need to investigate varicocele this much," but there is a really significant recurrence rate, unsuccess rate. So I am working on this subject more and more every day.
Yeah, it's good. I mean,
Yeah.
we need more men's health.
Yes, yes, and yeah, this is a new area. Testosterone levels. Many patients are doing it in European countries after 40 years of age. I heard and I'm shocked. I'm surprised. Many people, if they have varicocele but they have children, no problem. They have no
Exactly. Then they say
pain,
no.
no problem. But they do varicocele surgery. They want to get rid of varicocele. This is not an overall accepted indication yet, but in the future it may be. We need more research. Thank you very much for explaining this. We need them. People from abroad, they hesitate. They don't understand if it is possible to come here to do this. Is it working? And
It's very, very difficult and very scary to go abroad, but I research a lot, and I'm happy also to see that you are above my expectations.
oh, thank you very much. Nice to meet you. See you in the future without problems.
Okay.
See you. Bye.